Okay, let's talk about that nagging, persistent lower back pain. You know exactly what I'm talking about. The kind you stretch, you rest, but it just keeps coming back. Well, we're going to dive deep into a question today that might just change everything. What if the real source of your pain isn't your back at all? Seriously, why does it still hurt? You've probably tried it all, right? Massages, the special back stretches, maybe you even bought a new mattress. And yet, there it is. That same old ache that just refuses to leave. It's an incredibly common frustration, but the solution might be hiding in a place you'd never think to look. And this is the big twist. What if I told you we've been blaming the wrong body part this whole time? The real culprit behind that chronic ache might not be your spine. It could actually be your hips. I know, it sounds a little strange, but stick with me here, because understanding this one connection could be the key to finally getting some real, lasting relief. So let's get into it. How on earth can your hips cause so much grief for your back? Well, it all comes down to a simple idea. Your body isn't a collection of separate parts. It's one big, interconnected system. Here's a great way to think about it. Picture your pelvis, your hips, and your lower back as links in a chain. Now, what happens when one of those links, in this case your hips, gets stiff or weak or just out of alignment? Well, the next link in the chain, your lower back, has to pick up the slack. It's forced to compensate, taking on all this extra strain and movement it was never, ever designed for. One of the biggest culprits here has a bit of a technical name, anterior pelvic tilt. But all it really means is this. When we sit for a long time, the muscles at the front of our hips, called the hip flexors, get super tight. And what they do is literally pull your whole pelvis forward and down, which forces your lower back into this really exaggerated, stressful curve. And you can see the difference so clearly right here. Just look at the image on the left. See how with a neutral pelvis, the spine is nice and aligned? The body's weight is distributed evenly, but now look over at the right. You can see that forward tilt in the pelvis, creating that deep curve and literally compressing the bones in the lower back. That compression, that's where so much of the pain comes from. But, it's not just about tightness in the front. It's a two-part problem. It's also about weakness in the back, of your legs, that is. When your glutes and your hamstrings aren't strong enough to do their job, which is to support your hips and power you forward, guess what has to step in and do all the heavy lifting? Yep, your lower back muscles. They get overworked just from you doing simple things like walking or standing up. All right, so that's the theory behind it. But how do you know if this is actually what's happening to you? How can you tell if your back pain is really a hip problem in disguise? Let's go through a few telltale signs. As I go through these, just see if any of them ring a bell. Okay, first one. Does your back ache way more after a long day sitting at a desk? Do you feel this constant tightness right at the front of your hips, maybe in your groin area? Now here's a big one. When you stretch your back, does it feel good for a minute, but the relief just doesn't last? But when you stretch your hips, does it seem to help for longer? Or maybe you just find it really hard to do a deep squat? If you're nodding your head to any of these, that's a huge clue that your hips are part of the story. Now for the good news, and this is the best part. Once you identify the real source of the problem, you can actually start to fix it. And we're not talking about some crazy complicated routine. It all comes down to a really simple, targeted action plan to get your body back in balance. It all boils down to this 4-part strategy. Super simple. Step 1, we have to stretch those tight hips to release that tension. Step 2, we've got to strengthen the muscles that are supposed to be doing the work, your glutes and your core, to take the pressure off your back. 3, we just need to move more often to break that cycle of sitting. And finally, number 4, we have to start paying attention to our posture so we can keep that pelvis in a happier, more neutral position. And to make this really practical, here are some things you can actually do. For stretching, think about things like deep lunges or a yoga pose called pigeon pose. For strengthening, moves like glute bridges, clamshells, and planks are absolutely fantastic. The movement part, it's as easy as it sounds. Just make a point to get up and walk around for a few minutes every hour. And for posture, just try to be aware of that pelvic tilt and gently tuck your hips under to find that neutral spot we saw earlier. So really, what this all comes down to is a complete shift in how you think about your back pain. Instead of just focusing on the spot that hurts, you start to look for the root cause. You start looking at the bigger picture. And if there's one thing to take away from all of this, it is this simple phrase right here. It really does boil down to this. Treat your hips and your back will thank you. When you finally give your hips the attention they've been crying out for, through stretching, through strengthening, your back can finally relax and get the support it's been missing all along. So as we finish up, I just want to leave you with a question to mull over. Thinking about everything we've talked about, what's just one small, simple step you can take today, right now, to start freeing your hips and in turn, start healing your back for good?